Hi friends, welcome to my channel. My name is Rosie and I am here to talk about my life as a disabled person with several chronic illnesses. So on my channel, you'll see videos about life with a chronic illness, being a disabled mom, being a US citizen, living in the UK, trying to get hopefully better medical attention, some vlogs, various other things. If you like the content, I hope you'll subscribe. You can also find me on Instagram and my Patreon, Honestly Rosie. I will put a link in the description down below. If you've just come here, my channel is kind of in a transitional stage, which is weird because I'm just starting it. This isn't exactly how I envisioned the videos will be looking for very long. As I said, I am living in the UK. This is something that's very new, and I am in a temporary living situation with my in-laws. I have very little space and very little energy due to the stress of living with in-laws for multiple months. So I have very limited energy right now, and if you're a spoonie, you'll understand that you have to save your spoons. And also, as a homeschooling mom, right now my spoons are going to my kid. So I am keeping my editing very, very basic, as I do everything myself. So right now, this is just bare bones, me talking to a camera for the most part, and just keeping it really basic and low tech. So this isn't exactly the vision I have for my channel, but it is the temporary startup vision that I'm going with the energy I have at the moment. So today what we're going to be talking about is something, an article I came across over this week, just in the news, and it was, I'll put a box up to show you, but it was something titled like, they've decided that chronic pain patients should turn to exercise rather than anti-inflammatory medications like ibuprofen and things like that, pain relieving medication with anti-inflammatory. So I went kind of on a rant on my Instagram about this and got quite a bit of feedback, so I kind of wanted to do a little longer form than just like a minute or two on my stories about this and why this is such a damaging article to those that suffer with chronic illnesses and chronic pain, in multifaceted ways. You know, there's first of all the fact that often people with chronic pain are exercise intolerant, and there was a study done to see what came first, the exercise intolerance, or did the exercise intolerance come from being bedbound and physically inactive from chronic pain. And the study did find out that the exercise intolerance comes first, and it's followed by the inactivity. So the inactivity is not the causation, which leads us to believe that the exercise intolerance is not due to laziness on the patient's part, which is a rhetoric you get a lot when you're a chronically ill patient, which brings me to the weight bias that happens so frequently in medical settings, where someone that is clinically overweight, which the BMI is garbage, and we don't have to get into that in this video, but the fact is that if someone has the wrong BMI and comes in complaining of chronic pain or symptoms that would lead to looking for some kind of chronic illness diagnosis, often those patients are turned away and the doctor tells them to just lose weight, and that their symptoms should be relieved by that. This is really, really dangerous because so many things can be left undiagnosed when not examined and dismissed as obesity related issues. And it's so many things have been missed due to this, and it's so common, unbelievably common. And I actually want to touch on that because before I became fully disabled, I weighed a lot more than I weigh now, and I would be what is technically considered overweight, although how much overweight is debatable. I want to say though that my pain gets worse with every pound I lose at this point, and I think it's heightened by the fact that I can feel my bones. There's no cushion when I injure myself, and because of the way my body injures, it's different, it's heightened, and it's really painful, honestly. So to those doctors that say that, I want to be like, you're full of shit. I can attest to that. So not just like, you know, that, but also it's bullshit. There are multiple studies on various chronic illnesses and how exercise and those illnesses go together. And there are multiple chronic illnesses where exercise can be damaging and progress the illness very quickly. And this is the case for what Americans would call chronic fatigue syndrome. Here in the UK, they call it ME. They've shown that what's called graduated exercise therapy, which was originally designed for CFS and ME, is actually really, really dangerous. But some doctors are still practicing this, and it's really like taken away the quality of life of many, many patients with CFS and ME, with things like POTS. You have exercise intolerance, so you have to make sure you're doing the right exercises. It can't be much cardio. I personally have POTS, and the only kind of cardio I can do is seated. I usually get some kind of like small machine I can use with my hands and legs, like a bike machine, but I could put it tabletop or on the floor. And that's kind of how I've handled getting just a little bit of a heart rate up, but I'm still seated. That way, if I feel faint, I'm right there, I can stop. And I can only do 5 minutes a day, max. Most of the time, I can't even do that. Sometimes it's 5 minutes a month. So, you know, it's very important with POTS that you're paying attention to your blood pressure and your heart rate and all these things that could make you faint and cause blood pooling and all these other host of issues for POTS. For someone with a hypermobility syndrome such as Ehlers-Danlos syndrome, it is really dangerous because if you do the wrong exercises or stretches, you could dislocate a joint. Because of your hypermobility, you're prone to overextending and injuring yourself, so you have to make sure you're doing the correct exercises. So this basically all to say, exercise can be beneficial, and I'm not saying nobody can do it, because that's just not it. What I'm saying is every illness needs an individualized plan with a physical therapist that is specialized in those illnesses, that knows what they're doing, that can say this stretch will hurt you, don't do this, do this. I mean, like even for my endometriosis and my polycystic ovaries, I can't do Kegels or even like core exercises like Pilates, crunches, things like that, because my pelvic floor is so tight and wound up that any tightening in that region just makes it worse. So there are so many things like that are very basic and seem common and shouldn't be a problem, that are absolutely a problem for me. So it's just really important to work with someone that really understands what you specifically have, what you're going through, and then once you do have an exercise plan, it's not gonna look like anybody else's exercise plan. It's gonna look like you're probably doing nothing. Like when I do my exercises to put my hip back in alignment and my neck back in alignment and things like that, Literally, it looks like I'm doing nothing because I'm just making teeny contraction movements because that's all I can do with my hypermobility. It's also not going to fix anything. What it's going to do is improve parts of my life. For instance, because my right hip goes out of place and out of alignment frequently every day, if I don't put it back in alignment every day, when I sit down, my butt bone is in the wrong spot. And all I feel is this bone jutting out, and it hurts so bad to sit down on things. So when I do my stretch and that butt bone goes back into place and it's not hurting anymore, I can sit down without as much pain. Is that solving my knee pain? Is that solving my nerve pain? Is that solving all the other things going on in my body? No, but taking away one thing is a big thing. It improves life, it improves your sleep, it improves sitting on the toilet, believe it or not, just like all these little things. So yes, it is important, but it is not something that takes the place of an anti-inflammatory and pain reliever. It does not relieve all the pains. It does not fix it. It does not cure it. And this is also important because a lot of times when people without a chronic illness see an article like this and they have a friend that possibly has a disability or illness, and they see that maybe their friend isn't exercising, and they think, if they would just exercise, they'd be fine. They could come hang out with me and live a normal life. And so then it gives that ableism some fuel to not understand what we're going through and think that it's our fault that we're not getting better, and we're just choosing to be sick every day instead of doing that simple 30-minute workout that article talked about. And that's really what's so damaging, is how it keeps perpetuating the ableism that we are constantly fighting to just get our basic access needs met. And it's really exhausting. It's really exhausting too, because we're not only fighting the basic ableism within society, but also within the medical system and within the government. And it's so big and it's so huge, and it's not something anyone thinks of unless it's happened to them in some capacity, whether personally or someone they loved, because it's not in your world and you just don't see it and you don't know it's a problem. I didn't know it was a problem either. And my eyes have been so open in the past year to all my internalized ableism. I'm still working through it. My partner is still working through it. But we as a society don't seem to be working through it. We seem to be working through a lot of stuff, but it doesn't seem to be this. Because when I bring things up, people do not want to have those conversations. They'll converse about almost anything else, but when it comes to internalized ableism, people really shut that conversation down, feel very dismissed whenever I bring it up. And that's problematic, because we're not going to grow as a society until we start listening to those who are experiencing it and that are living it firsthand. And we need those people in places that make decisions, because these articles need to stop being written. If a disabled person worked at that publication that released that article, I guarantee that would have been red flagged and corrected and said, like, hey, this is a really damaging article. We need to reword this and highlight the truth of this method. So that is my rant for this evening. I hope you enjoyed or learned. If you did, give me a little thumbs up and maybe a subscribe if you'd like to see more of my rants, and potentially in the next few months when we get our own space to live in, maybe some fancier edits and like a jingle in the beginning, some kind of logo, you know, cool stuff like that. Good night, friends. Sending love and warm hugs to you all.